Chronic pain is not an issue for medical doctors. Fight me. Yep, I said it, and I know a lot of people are going to get pissed off, but I will repeat, it is not an issue for medical doctors. The fact that we in society don't really understand that is why we have over 100 million people in America alone with chronic pain issues. I'm taking that number actually from a congressional hearing from 2012, which I reference a lot, where Senator Harkin, the presiding chairperson, he actually says 116 million people in America have chronic pain. That was in 2012. It's way, way worse. And the reason it's so bad, the reason so many people get it, and the reason our medical system can't help them is because it is not actually a problem for the medical community. Okay. And I'll explain more. And yes, this is meaning to grab some attention and get you thinking, but it's also true. So, the first thing to understand, there are two main types of pain: structural or acute pain, or chronic or neuroplastic pain. Structural or acute is when, like me, you break a toe, like I did on Thanksgiving, or you cut yourself, or you burn your hand, or you fall off a ladder and break a bone. It could be when your appendix needs to come out and your body makes that signal. Structural or acute pain has a very clear cause, and it's something very short term. And mostly our body is expert at healing itself of this stuff. Chronic or neuroplastic pain is pain that lasts over 3 months, to make it quite simple. It's also pain that may have no clear cause, fibromyalgia, something that just comes out of nowhere. Often people with chronic pain will attribute it to an accident or a medical procedure gone wrong. That's very common. You'll see people go through a medical procedure and then their brain will kind of start chronic pain and they'll attribute it to that medical incident, even though it's not really from that. So, understanding those two different types of pain is essential. And with that premise, we can then understand why our medical system is so unbelievably useless at helping people with chronic pain. It's because they don't understand the real cause. And because they don't understand the cause in the first place, they can't heal it or do anything about it. So, what is the cause? Well, the work that I deal with clients and in my new group that I'm starting, and I'm, one of many people who are in this world, is something that you might call mind body healing. Dr. Sarno from NYU's Rehabilitative School of Medicine, the Rusk Center, he was the one who kind of pioneered it. He was at NYU from 1965 to 2012, and his work basically grew to connect chronic pain and conditions to repressed emotions. It sounded crazy to me. It sounds crazy to a lot of people. But lo and behold, I'm 54. And like so many people in this world, I had a chronic neck issue, chronic back issue. Nothing was helping. I tried everything: acupuncture, physical therapy, magnets, heat, went to nerve specialists. I got all the MRIs, the x rays, the doctor dances, I call it. Nothing worked. And it was only once I read Dr. Sarno's book, The Mind Body Prescription, that my pain went away. My neck brace came off. And now I run marathons, and I really attribute it all to Sarno's teachings and the people who followed, what I call sons of Sarno now. There's a lot of great books and teachings out there, and I've become a teacher after decades of working on it and healing people and healing myself. But bringing us back to the main point of why doctors can't do this and why it's not a job for them is because they are not useful. And to be clear, doctors are fantastic. Everyone needs a doctor. They're great at maintaining regular health. I got the home colonoscopy test. I did my blood. I have to work on my cholesterol. You don't have to be anti-doctor to have your life changed by the work of Dr. Sarno. It's just differentiating between structural pain and regular medical upkeep and dealing with a chronic condition and chronic pain. And that is why we're starting to have success at treating this stuff because we're recognizing the big difference there. So when I had my pain and was wearing a neck brace for months and months, I was in my 30s, I was a baby, it made no sense. I thought I got injured running. I realize now that wasn't the case, but that's what I attributed it to. Nothing worked. So when I say that chronic pain and conditions are not something for the medical community, I had to solve my own pain myself. And again, a lot of people will scoff and say, "How dare you? You're not qualified," or because you didn't go to medical school. That is one of the most harmful ways of thinking out there right now. And it's why so many people remain suffering from that false assumption that we cannot trust in ourselves and look into our body and ask ourselves questions and feel how we're feeling and make determinations. Okay, so I healed myself with one of Dr. Sarno's books, and then I had multiple episodes again of chronic pain over the years, many, many, many years later. And I did it again. So I heal myself with the knowledge and the coaching and the help of others. Okay, I had a very expensive therapist that I got from one of Dr. Sarno's books. That was the second time I got chronic pain. I had chronic knee pain, and I immediately quit running for a year. I assumed that because I ran 30, 40 miles a week, that was somehow connected to my knee pain. Made no difference, by the way, that I stopped running for a year, which we'll get to that in another video, but that's a dead ringer. That's a clue that your pain is neuroplastic or chronic when common sense changes and differences have no effect. Chronic pain and chronic conditions, and again, this can include not only neck, back, knee, hip, toe, foot, tongue, eye pain, seen all of that and more. It can also include digestive issues, very, very common. A lot of the people with digestive issues out here have this neuroplastic pain, migraines, fibro, endo, POTS, chronic fatigue, another huge one. All of this stuff can be healed with this stuff that we call mind body healing. It's all relates to connecting these chronic issues to what's going on beneath the surface and repressed emotions and rage and stress and all this stuff. And I'm going to get more into how that works in other videos. But the main point I want to make first is that it is not an issue for doctors. That is why they are so useless at helping people with chronic pain. They were never taught to connect this stuff to emotions. The things that they were taught, they were devised decades and decades ago. It's never been changed, even though it doesn't work. They have a lot of false ideas. They'll often attribute chronic back or neck or knee pain to bulging discs, herniated discs, nerve compression. The science does not support that. There's many, many studies. One of the first was from 1994 in the New England Journal of Medicine that showed plenty of people, dozens, have disc bulges, herniations, nerve compressions, but have no symptoms. So just think of that for a minute. Why would that be if a doctor is telling you you are having your back pain because of a bulging disc, but if I can show you 70 other MRIs or x-rays that show the same thing, but they don't have any pain, how do you reconcile that? It doesn't make sense. The medical community does not use science right now to diagnose and treat chronic pain and conditions. That's another reason why you see thousands of people every year getting their hip or their knee or their ankle operated on and replaced. And there's no scientific backing that does anything effective. It's really a tragedy. I'm watching a guy I know now on Facebook recovering from his hip replacement surgery. It was like the guy was stabbed with a sword. You know, he can barely walk for a month. It's terrible. He had to go back to the hospital. He almost got infected. Cutting yourself open is more often than not a huge mistake, and you don't need to. Okay. And so you can watch my other video about the congressional hearing with Senator Harkin, where he describes how he almost got a surgery for his chronic back pain. And luckily, someone, funnily enough, who was one of the chairman of the board of one of the biggest hospitals in America, Thomas Jefferson Hospital, said, "Don't get your surgery. I want you to read this book first." by Dr. Sarno. So even the head of a major hospital told a United States senator not to get an operation, but to read this book first. Even people in the medical community don't trust the medical community to help with chronic pain. And I want to add a quick disclaimer. Anytime you're treating a chronic illness, go to the doctor first. Have them do all the checkups. I did it multiple times. Anytime I had chronic pain, I got the MRIs, I got the x-rays, I listened, I did what they said, I did the physical therapy, I went to acupuncturists, I tried everything. None of it worked. That's why I was forced to take matters into my own hand and learn about my own body and pursue this thing so that I'm now in my 50s and running marathons. I'm going to cite a book now, actually, by the great John Kabat-Zinn, considered by many to be the father of mindfulness in the West. He wrote a book called The Full Catastrophe, and it was about how he started hundreds and hundreds of stress reduction clinics in hospitals around the world. There's over 900 of them now. In the book, he talks about how symptoms are a message from our body trying to tell us something. And we often try to cut these messages out with surgery or dull them with drugs instead of listening and figuring out what's really going on. He also speaks in the book of how we need to take responsibility for our own health. Instead of lying on a gurney and just letting a doctor do what he wants and hopefully giving us an answer, by taking control of ourselves and going into ourselves and taking responsibility, that's actually how we can really start to heal. So, this is my premise. The medical community should not be treating chronic pain. They don't know what they're doing, and that's why they get zero results. By the way, if you're new here, I'm Mr. G, and I am a coach for women with chronic pain. I'm also starting a healing group that anyone can join about how to get rid of chronic pain and symptoms. There's some links down in my description if you want some help and to reach out to me. I do a zero pain challenge online that's free where I walk you through more of this and we can look at your own problems. If you are trying to solve a chronic condition in the medical community, you're wasting time and you're suffering a lot needlessly, and you don't need to. All right? Keep following for more about the real causes and the real treatments for chronic pain.